Hi, guys, and welcome back to the show today. And I want to start the show off today with a question, and it's about stiffness, soreness, and tightness because many of us over the age of 40 experience this symptom at some point in our lives. And in fact, many experience these symptoms and think that tightness is no big deal. Now, in my 57 years, I've experienced tightness more over this 50-year decade than ever before in my life. And I'm seeing others during this age decade experience this as well. And it's for that sake, I want to talk about these symptoms. I want to discuss what I see in my studio, and I want to relate it to the literature and the research that we have currently available to us. So I want to start this out with a question. If you feel stiffness in the morning, that morning stiffness, if your ankles or your feet or your back take a while to loosen up before you can move, or if you have tightness that ever fully doesn't go away, no matter how much you stretch it, and if you've told yourself that this is what getting older feels like, that's sort of the scenario I want to put in front of you today. And I want to tell you that aging is only part of what you are feeling. There is something deeper than your muscle, something that has a name that is documented in the research. And nobody really told us about this documented research. And that's almost the bigger problem. Now, there is a cycle that runs that causes us to be tight, stiff, and sore. And it's for reasons that we really have not been introduced to. Most of us know to look for pain. We know to look for tightness as no big deal. Pain is sort of that switch of, I got to go to the doctor because I can't take this anymore. And usually, I don't know if it's you or not, usually that pain has gone on too long and now you're just tired of it and you're over it. Well, there is a cycle that is happening that is beneath the surface of your larger muscles, and it is documented in the research and the literature, and I actually call it the silent shutdown cycle. Once you understand it, a lot of what has been confusing about your own body when it comes to these symptoms are going to make sense to you. So, first is the belief that keeps most of us stuck. Most of us have been taught that when something feels tight, that tightness is coming from the muscle. And the answer to that tightness is to stretch it, to do foam rolling or push through it. So that's what most of us do. We stretch, it feels better for an hour or two, then the tightness comes right back, and we assume we just need to stretch more because when we did stretch, it felt good, it felt better. And what I want to ask you today is, are we doing something wrong when we stretch a tight muscle? And I want to dig into that today. And here's what is actually happening and not typical of what we're told is going on. That tightness is not a muscle being shortened. That tightness is a signal, and it's your body responding to something deeper at the joint level, where your bone goes into another bone. Then that is where it's coming from. That message is coming actually from the joint capsule and from something that we call the movement system. And to understand it, you have to know one thing about how the joint is supposed to work. Now, inside a healthy joint, the bone is supposed to move. It has a small amount of space to glide, slide, and spin, and the capsule around it is supposed to have enough space for that to happen. Now that space is what allows you to move, and it is an accessory motion underneath range of motion, and it's not something that you control directly, but it is the foundation of healthy movement. Now, the cycle begins at the joint level. That is your messenger, okay? And that messenger can send a signal typically post injury, from inflammation, from wear, or sometimes it happens for no reason at all. And that's what I want to talk about today. When you wake up one day and you're tight, you're stiff, you're sore somewhere in your body, but yesterday you had none of that. This is the cycle that I want to talk about. Now, the cycle is actually a protective mechanism from your nervous system. And this cycle actually inhibits your muscles, and it inhibits the larger muscles and it inhibits the deeper muscles that are supposed to support your joint and your joint capsule. Now, in the research, this cycle has a name and it's called arthrogenic muscle inhibition. And it was defined in a foundational paper by Hopkins and Ingersoll in the Journal of Sports Rehabilitation back in 2000. And it has been studied at the knee for decades since. And there is growing evidence now at the hip and other joints. Now, the muscle is not damaged. It's not weak in the way that most of us understand what weakness is. It is being sort of turned down. The message is turned down, okay? That means it is inhibited. The function is inhibited. And this is inhibited by the nervous system. Now, the joint is the messenger and it sends a signal, and the muscle that should support that joint, it doesn't support it anymore. It's inhibited. It doesn't function and it doesn't activate. And then that means the support that the joint capsule has now has to come from something else. So it has to come from the larger muscle. And the larger muscle, when it supports the joint capsule, then it actually is holding and trying to move. And it can't do that adequately. It's doing all of the functions on its own. So that is when your range of motion is limited. And that's when you're going to find that you feel that tightness, that stiffness, and that soreness. Now, I call this the silent shutdown cycle because that is exactly what it does. It shuts the muscle down and it does it silently. And if you don't find this cycle, it is pretty aggressive and progressive. And the end of that road are falls, arthritis in some people, lack of mobility decline, and so many other things that we see in, our 60s, 70s, 80s, and beyond. Now, your muscular system, it has two layers. It has a deep layer, and that deep layer is small, deep muscles, and they are built to stabilize the joint and to hold it steady and center the bone where it's supposed to be centered so that it can move and function well. And then there is a larger layer, and most of you know about these. These are your bigger muscles, and they're built to move the joint and to build strength. And when the silent shutdown cycle begins, both of those layers are affected and they both fail in different ways. They're both inhibited, but the function of what they do due to this inhibition is different. When the deep stabilizers get inhibited, they actually lose the steady base for the joint. Okay, so the joint is now off center. The larger muscles respond by bracing and holding. And those larger muscles start falling into a guarded holding pattern. And they're trying to protect the joint that has lost its support from the deeper muscular system. Now, that guarding, that bracing, that is the tightness, the stiffness, and the soreness that you feel. So when you stretch that tight muscle, you're not fixing the problem. You're pulling on a muscle that is actually holding because the nervous system is actually asking it to hold. It's holding to protect a joint that has lost its stability. And that stretch is going to calm the nervous system for a little bit of time, but you're going to notice that you get tight again. So we perseverate and feel the relief that we get instantly, but we don't think about how we continue to get tighter and tighter and tighter, and how that tightness comes back all the time. And this is why stretching never seems to hold. You have to be kind of looking deeper at the movement system and what the body needs to better understand how to support the body. And we've been taught to look at pain as a problem, or tightness as a frustration or an aggravation that we need to treat. But what we need to do is listen to our bodies and give our bodies what it needs so that it has the support that it needs to move. Now, the silent shutdown cycle, which is in the research called arthrogenic muscle inhibition, this is well documented, but it's almost always studied after something obvious has happened, like after a surgery or after an injury or after a joint already has a problem. That part is established. Now, in my studio, what I believe the science points to, I think, is the same cycle can begin much earlier and much more silently. And for nothing more than loss of joint mobility that started as loss of a little bit of joint motion in that accessory motion of the joint inside the capsule. And this is when the movement is restricted and where the movement is restricted. And at this point, you're not going to feel this restriction and you're not going to feel any pain. The trigger is often something we know nothing about, that we can't even name. There's not even a trigger as to why it happened. So you're not going to be able to say, oh, it happened because I did this. And most of us think that it happens, because we slept wrong, or we need to get a better pillow, or it must be because of external factors. But we need to look internally, because this cycle starts at the joint, that's the messenger, and then inhibits the muscle. And then there's a cascade and a predictable path that this cycle follows over time and through the different decades in our life. Now, I want to discuss 3 case studies with you today. And today's case studies are 3 females. One of them is 49 and the others are in their 50 decade. All of them were hypermobile as children. And these have 3 different lives, and these 3 people have 3 different symptoms, all of which have cycled in and out of pain in different ways and different times in their lives. And I want to say up front that these are real people that I have worked with, and the results like theirs vary from person to person. I am showing you these because I want to show you a pattern that I keep seeing. Okay. I'm not promising a specific outcome here. I want you to see the pattern that happens with this silent shutdown cycle. And I'm not going to use any names for this portion of the show. I just want you to see the consistency. So the first one is a lady who is 57. In her history, she has hypermobility. She could actually put her legs behind her head as a child, and splits were very easy to her. And she could actually sit for long periods of time in these splits. But after age 40, she reported that things began to feel tight, started in her hips and her back. And she's been in and out of pain for the past 17 years. And she's tried every gadget, every pill, physical therapy. She's done chiropractic. She's had specialists. She's gone back and forth to the surgeon. The surgeon and the chiro both tell her you just should go ahead and get both total hips replaced. Now, she couldn't, in the last few years, get down to the floor or up off the floor. And she felt like her body and her core was disconnected. She reported fatigue, tiredness. When she went to get in and out of bed, it took her a long time. And she couldn't stand after sitting from a normal height surface. And when she went down, she really had to brace with her arms to lower herself down. And she said it didn't even feel like a human movement when she did. She said her core would never engage, and she did Pilates, she did yoga, all of those things. And she, when she sat at a table, guys, she was really interesting. When she sat at a table, she had to put a pillow down on the table and lean on the pillow with her arms, because her hips felt like they were totally shifted to one side and her spine was shifted up at an angle to another side. So it was almost like she was 2 different people and just holding herself up at an angle. And people had told her many times before that one of her legs were longer than the other. And she felt like her body was completely locked down, and it was taking her about an hour of stretching just to move, not to feel better, but just to be able to move. She had lost reaction time. All of her pathways were not working. Her muscles were not activating. And when she arrived, she had a shift to one side and her spine was not straight at all. She denied any scoliosis. I did some movement testing and she could not get down to a 16-inch height surface. She could get down to a 26-inch height surface without a plop in the testing. And when I tested the joints of her lower back, her mobility is in what I would call and test at accelerated decline. Her hips were essentially locked down by restriction, and her body was not allowing movement from them at all. It was all coming from her back. And in my testing, her spine had only a fraction of the accessory joint motion I would expect to see. Now, she started a healthy movement jumpstart program, and after her first session, she was standing more straight. Her second session, even more straight, and she could stand from a 22-inch height surface the second visit. Now, at visit 3, she felt like her core was able to engage. By visit 6, her testing had moved from that accelerated decline range into a healthy range for her spine, but her hips still remained meaningfully lacking accessory motion, and she was standing taller. She could get down to the floor, but it took some effort. She still has some work to do, but her movement system was more connected than it had been in a couple years. And I wish I would have taken a picture of her back because her changes were pretty remarkable. And now she's standing tall. She has some movement in her hips and her body feels more connected. And she has a lot of work to do. Now, in another case study is a female 56-year-old, hypermobile as a child, and she's always felt like her body was tightening up. She has a history of going in and out of like just clicking, and she felt like because of the chiropractic adjustments, she just needed to pop her joints. And she's always had like a hip that always clicked, and she was always perseverated on these clicks and these pops because they gave her some sort of immediate relief. And she felt like that was a good thing, is just popping, that relief was there for her. And what she didn't have was stability. And now she was locking down in her hip and her knees. Now, she had been seeing the chiropractor for the past 6 or 7 years to maintain a pain-free life. When she came in with her knee, it was locked up and she could hardly put weight on it. She didn't experience any pain. It's just it was completely locked up and couldn't move. Husband was blaming her weight for her knee problem. And in our intro session, I tested her lower body joints and her movement system. And in my testing, her lower body was in accelerated decline. Her knees and feet had a moderate amount of accessory motion, but her hips had almost none. And she was 4 sessions into her Jumpstart program and would be reassessed for her 6th session. And she's already been able to decrease her frequency because her joints are moving so much better. So it'll be interesting to see what her scores are, because her knee was locking down because her ankle did not have any accessory motion in the ankle joint, in the midfoot. The forefoot was locked down more on one foot than it was the other foot. And on that side with the knee that was locked down, her hip also was 100% locked down. Now, and for her, she was wearing sandals, and it's common that when people are wearing sandals over the summer, I do typically see some people that come in and their knees locked down, or they're tender. And those people, it's typically because they've been wearing a different footwear and they didn't have the external support that they probably needed, but they had lost the internal support as well. Now, the third case study is a lady in her 40s decade. Now, she's 49, so she's right at that point of menopausal. Now, this one, she was a challenge. She has fascial bands that were like vice grips in her hips and her thoracic spine. In fact, when she laid on her side to move her leg over when she's on her side, like you bend your knee up, sort of in a just a relaxed, it's not hook lying. Hook lying would be on your back, but side where your knees are bent up. She had to put a really thick pillow between her knees because she didn't have that mobility. The fascia was just rigid down her legs. And she had picked up a child several years ago. She works with children. And she really lacked hip mobility. And she just had these fascial bands all over the place. And she was hypermobile when she was younger, but she said she can't remember always being mobile. She can remember always being tight. Now, she came in and did a full body healthy movement test, and her results showed accelerated decline across more than 80% of the joints in her body. She was 49. Now, she's worked very hard and she's been with me unlocking her mobility for about 6 months now. And she started with a healthy movement jump start, then went weekly for about 3 months and is now at a twice a month program. Now, her testing has moved out of the chasing symptoms, accelerated decline range, and is into a much better place. And she's still in decline, but no longer in the accelerated symptom chasing decline that she started. Now, these three ladies, all entering menopause or postmenopause, were all hypermobile as a child. And they came in for different reasons, but all from no injury. They all just woke up one day with pain. It wouldn't go away. They tried all the treatments out there. They did massage. They're working out. They're following all the recommended advice. And they woke up one day with pain. And when the day before, they were perfectly fine. So they had no reason or cause for the symptoms that they had. And these are some of the people that I see in my clinic. All of them made real fast gains, and they are now learning to listen to their bodies and understand when their joints need support. Because, guys, if you have pain, pain is a warning sign that your body cannot compensate any further. We've been taught that pain is a problem that we have to treat and take medications for and inject. But pain is really just a symptom. It is a signal from your body saying, listen, I've turned everything off. I've done everything I possibly can to allow you to move. And there's nowhere else in your body that I can turn off. That's all it is. Okay. Your tightness is because of the inhibition that has been going on for so long. And this is accelerated and predictable, and it can get aggressive if you don't identify what is going on and support your body in the way that it's looking for. Because we've seen this in the research, right? We see increased surgeries, we see falls, we see the last 12 years of our life that we are not moving like we used to move. And it's almost like our body has lost a lot of function, and it has. It's actually lost capacity and function. Now, these clients that come into my studio, they're learning about this silent decline cycle, and they are moving better than they did years ago. Now, I had a lady in this same age range group just today tell me her knee started hurting this morning when she put weight on it when she got out of bed, and then the hurt disappeared. She told her husband it was tender now, not really hurting, but she said she didn't know where her problem was coming from. She was 57. She said she had plantar fasciitis years ago that went away, but it seems like her problems shift. She wakes up with a different problem in other areas. She'll feel better. And she asked me, is this what this decade of life looks like for all women? And we laughed and we worked on our lower body. Guys, this is the Silent Shutdown Cycle live, inhibiting in these women. And one day you feel great, and the next day it's like something came out of the blue. And this is why a strong, fit person can be in movement decline and have no idea about it, because strength is going to hide it. The muscular system is an expert at compensating. And all of these ladies, their compensation patterns were all totally different. Okay. None of them did strength training, and they were all hypermobile. So they did have that in common. But all of this started at a joint that was restricted, muscles that were inhibited, and the body compensated until it couldn't compensate anymore. And they came in because they had run out of ways to treat the problem, and they were concerned that they were going to have to go in and have a surgery. And they didn't want to have a surgery. Now, when your body has a joint restriction in one joint or many joints, it reroutes your movement around that area, and you're not going to feel that it is doing that. And that's what's so cool about the human body. It does things to help you keep moving, to keep allowing you to function. And you're not going to probably have pain at that point. So you have no reason to think that there is anything wrong. And that's the most important thing to understand about this cycle. It is completely silent. And pain is not the beginning of a problem. Pain is actually the end of a long, quiet, silent decline. And the moment your body finally runs out of ways to compensate, by that time, it takes you to the doctor, and that cycle has often been running for many, many years. So here's what I want you to take from today's show. The tightness you feel is not something that you can stretch your way out of. In fact, the three women I just described all tried stretching, and it didn't give them what they were looking for. Tightness is a signal. It is information. It is your body asking for support for the joint. And when you give the body what it is looking for, it can give you back the capacity to move, and it can release the restriction that it is holding. Can actually calm the nervous system. And it's interesting how we live in our bodies for over 50 years, and yet we replace our cars every 5 to 10 years. And most of our appliances don't even last 5-6 years anymore. Now, the good news is, and it's genuinely good news, is that this is identifiable. And you don't want to wait for pain, okay? Because by then, your muscles have been inhibited so long that they lose a lot of their function. And you can maintain muscle mass, you can maintain muscle strength, but muscle function that you lose takes longer to come back, okay? It can be restored, it just takes years. And if you test and identify early, then you can decrease the risk of that inhibition causing too much of a loss of function in your muscles. And that's what you want to be aware of, is that putting this off and not knowing, usually pain is when your muscles are now going through what we call an atrophic process. And in that process, you are not only losing strength, you are also losing mass. And strength and mass are not the same, but that is not the only thing you're losing. You're losing muscle function. And to rebuild that function, you have to look at various things, and it is a lot of work. So at no point in this cycle are you too far along to make gains. You can make gains, but you're just going to have to work hard, and it's going to take you a long time. And this, when we're looking at this cycle, it can turn on immediately for no reason at all. So you could be coming in and seeing me and doing wonderful, and then one day go, oh my gosh, I feel like this hip locked down. And that's because the cycle can literally be turned on, and in 2 weeks you will feel a physical symptom. So this taking care of your movement system takes longer than a treatment takes. Taking care of your movement system is a lifelong thing. It's sort of like, having a car owner's manual, and how you take your car in every 3,000 miles or 5,000 miles to get an oil change. It's the same thing with your movement system, but it needs to be done more frequently in higher ages and less frequently when you're non-symptomatic. But you do need to test and identify, because you need to do that before you lose most of the function in your muscles. You need to look at the system underneath underneath the deeper layer of the muscle. And most of treatments are only going to look at that muscular layer, and it only looks at strength and range of motion. It really doesn't look at joint capacity and function of the muscle. Now, that is the silent shutdown cycle. And this is the first time anyone has explained why you're stiff, why you're sore, and why you're tight. And I hope this makes sense to you, because I want you to have the information that you need so that you can do something about it. So if you have experienced any form of tightness, any stiffness, any soreness, any achiness that doesn't just appear one day and then it doesn't go away, that silent shutdown cycle is typically active, and that is what is stealing mobility. That is that cycle causes you to be on a predictable path, and changes in your joints, changes in your muscular system, changes in your movement system, and the way that it communicates actually is very, very important for you to understand. And most people don't understand this at all, because we relate movement and movement function to pain. And if we don't have pain, we feel fine. But we need to test to see if this cycle is active, to see how much function we have lost, how much capacity in the joint, and how much function in the muscle. So I hope you found all of this information helpful today. I can cite some sources for you if you want to know these sources, but arthrogenic muscle inhibition, it is real. And I propose that it happens silently, without us knowing, without a reason, because that is what I'm seeing within my clients in my studio. And if you suspect that this cycle is active in you, I'd love to connect with you, learn what's going on, learn, what joints are moving and what joints are not moving. I'm happy to schedule a virtual or an in-person testing session so that you can understand if this cycle is active or not inside your joints and muscles, because our goal here is that when you are, in that last half of your life, that you are able to do the things that you want to do, and you're not surprised that you can't get down to the floor or you can't get up. So I'll put a link in the bottom of the show notes so that you can schedule a session, whether virtual or in person. And I look forward to testing you to see what that silent shutdown is doing in your system. Thanks again for joining me, and I'll see you next week.